Welcome to the segment on pacemaker or ICD placement. These procedures are done in the cardiac cath lab. In this short segment, you'll learn why a pacemaker or ICD might be recommended, how they work, and how they're implanted. Pacemakers and ICDs, implantable cardio defibrillators, are used to correct heart rhythm problems. To understand why you might need a pacemaker or ICD, let's look at your heart's electrical system. A healthy heart pumps at a regular rate or pace that adjusts as the body's needs change. This pace is set by your own natural pacemaker, a part of your heart that sends electrical pulses to make your heart beat. But sometimes your heartbeat is too fast or too slow. Other times, your heart might go into an irregular rhythm. When a heart rhythm problem keeps your heart from pumping enough blood to meet your body's needs, your doctor will recommend treatment. If your heartbeat is too slow, a pacemaker corrects the problem by helping your heart beat at a regular rhythm. An ICD is a pacemaker with an added function. If your heart begins beating too fast or goes into an irregular rhythm, the ICD sends a shock to reset the heart's electrical system. Pacemakers and ICDs have two main parts. The pulse generator contains the battery and generates electrical signals. The leads are small insulated wires that send the signals to your heart. It takes about an hour to put in a pacemaker or ICD. During this time, you'll be drowsy but awake. First, the doctor injects numbing medication where the pulse generator will be implanted. This is usually in the upper chest area under your collarbone. You'll feel a brief stinging sensation. After the area is numb, the doctor makes a small cut to create a pocket. Next, the doctor puts a needle into a vein. Using X-ray guidance, the doctor threads each lead through the vein into the chambers of your heart. The medical team tests each lead to make sure it is placed correctly. Finally, the pulse generator is attached to the leads and placed under your skin in the surgical pocket. The team programs the pulse generator with the settings your heart needs. When everything is done, the surgical cut is closed. The pulse generator and leads will remain in your body. You'll probably stay in the hospital overnight so we can monitor your heartbeat. The next morning, you may have an X-ray and other tests to make sure the leads are still placed correctly and the pulse generator is working well. This is the end of the segment on pacemaker or ICD placement. To learn more about cardiac catheterization itself, check out the video segments called Preparing for Cardiac Catheterization and Recovery from a Cardiac Cath Procedure. Also, check out the segment called Life with a Pacemaker or ICD. If you have questions about this procedure, tell your healthcare provider.